my name is Dr. Nelly and I practice here in Collegeville, Pennsylvania. Today we're going to be talking about missing teeth, missing tooth options. Primarily, we're going to focus on dental implants. And some of the things that I see in my practice are our patients are losing their tooth due to a fractured tooth or due to a root canal that have been failed or have been there for a long time. And at this point, the tooth is no longer salvageable. So primarily what we're going to talk about here are some options. There's two options that we can talk a little bit more about. That first option is a bridge. A bridge is going to replace that missing area there. And in order for us to do a bridge, we would have to trim each tooth like that in order for us to secure a bridge. Now, a bridge is certainly a great option. It's certainly going to prevent any food from hurting the missing tooth area and the gum. However, what I find is that most patients complain of difficulty of keeping it clean. And also, if there is a cavity on either one of the two teeth supporting the bridge, now the bridge is no longer an option, and what was a one tooth problem has now impacted that whole area. So a bridge is an option, but there's some things that we want to consider. The other option is a dental implant. A dental implant is a threaded option that's placed in the jawbone, and sometimes when I tell patients this option, they get a little nervous because there's a little anxiety with having something being drilled in the jawbone. And when patients go through that procedure, they're very, very surprised that there's no pain because there's no nerve ending in our jawbone. It actually goes in nicely. It's a threaded option. It osseointegrates, meaning it bonds very well to the jawbone, and it is probably going to be the most stable replacement in your mouth. So that implant is placed. There's a tooth component that gets attached to the implant. And now the crown can be placed directly on the implant. We are not touching the adjacent tooth, so I'm going to put this back on, as you can see. And now you're able to floss in between there, minimizing any potential risk of having a cavity. And of course, that one problem maintains a one problem instead of having to incorporate other teeth in that treatment option. So that there is a dental implant, and that certainly can be a great option for someone that's missing a single tooth or even a few teeth in that area. The next option I'm going to talk to you about is I have patients that come to see us about multiple teeth. They're having difficulty chewing. They're feeling very insecure about their smile. They're worried, and they're sort of talking with their hand on their mouth because they're worried that as they're talking, they could potentially lose their denture. And we see that often where the denture is no longer secure. Over a period of time, the denture becomes loose. Some options could be having a few implants placed. You can see here the denture is very secure. Having a few implants placed, and I know I always have difficulty with this, but having a few implants placed, and the gold attachment here is the implant, and the denture has a housing component that now allows the denture to sit tightly, preventing that from dropping or, as you're talking, losing the denture. It has some longer extensions, so it's essentially a denture that has an attachment to it, so it doesn't feel loose in the mouth. So this is certainly an option. This can be either 2 or minimally or maximally 4 implants. We like to say 2 to 4 implants on the lower. The other option is having something that is going to be less bulky. This option is what we call our all-in-4 option. Great for patients that have a lot of bone. Not everyone can get this option, unfortunately, because over time, bone shrink. As you can see here, We start here with teeth, and then over time we start to lose bone. So sometimes we may have missed that opportunity. So having options like this, having a few implants, more, I would say anywhere from 4 to 6 implants, is plenty to have this option here. Now we're taking a patient from that longer extension to having a shorter component here. It feels just like natural teeth, able to clean there nicely. Patients love it because it looks natural. It's a tooth or smile replacement, and we call this the all-in-4. Sometimes it could be cost prohibitive. We understand that, and certainly, we can talk a little bit more about how we can make that affordable. But we've now talked about a single tooth replacement to now taking it to different options for our entire smile. We're now enhancing your smile with something that's more stable. So thank you so much for tuning in. I'm certainly looking forward to meeting with you. I know this is a little bit of information. I'd like to meet with you and talk to you a little bit more and see what we can do to answer any questions that you may have. So feel free, give us a call here at our office. And again, I look forward to meeting with you, and I'll see you soon.